This research is focusing on the SLP students' understanding of the importance of oral care.
My name's Claire Ford. I'm currently in the Communication Science Disorders graduate program at Iona College and will be graduating in May of 2021. At this time, we would also like to give acknowledgments to Catherine Barletta and contributions to Anastasia Gregory, both of whom are at different universities right now.
Hi, my name is Bianca Cavalieri. I'm a Communication Science Disorders graduate student graduating in 2021, studying speech-language pathology. I have been fortunate enough to work with Professor Vidal Finnerty, who researches areas such as dysphagia, bilingualism, neurolinguistics, and human education. Also, we have been fortunate enough to work with Nilsa Perez, who is the SLP at White Plains Hospital, who specializes in dysphagia.
This research examines communication science disorders students' knowledge, awareness, and understanding of oral health care as it pertains to dysphagia, which is also known as difficulty swallowing.
Before starting the research, we realized college programs teach important fundamentals of dysphagia but may not stress oral care in the curriculum. It is important to know the level of awareness, knowledge, and understanding students have initially, as well as the knowledge they gain with increased experience in their education and training. From this, we formed an idea about what we wanted to research, posed the question, and started the IRB and literature review. Throughout the research process, we have done continued research. Before we left for spring break, we administered surveys to undergraduates enrolled in the Iona CSE program, and as a pilot study, we administered surveys to graduate students enrolled in the Iona CSE program. Currently, we are analyzing the data collected. Throughout this research, we address whether a questionnaire can reliably serve as a tool for measuring students' awareness of the importance of oral care.
This research was started in November of 2018. The IRB was approved in November of 2019. Currently, we are in the process of analyzing the data. In the future, we hope to present at the ASHA convention.
Oral health is important to general health, and especially important to individuals with swallowing disorders who are at risk for pulmonary complications resulting from aspiration of oral bacteria. In this study, we hypothesize that second-year SLP undergraduate students will show reduced awareness and knowledge of the importance of oral care. Secondly, we hypothesize that fourth-year students will understand the importance of oral care as it relates to swallowing. As you can see in the pictures, these individuals require greater attention to oral care to minimize the risk of developing infection. Hopefully, this research can help colleges and universities form curriculum for dysphagia, taking into consideration the importance of oral care. Before starting this research, I knew I wanted to work in a hospital after observing Professor Perez. During this observation at White Plains Hospital, I was able to observe a bedside evaluation and watch a modified barium swallow study, which also allowed me to apply my knowledge that I have learned in the classroom. This observation made me curious as to how and why oral care impacts dysphagia. I decided I wanted to continue my education and further my knowledge about oral care and the impacts it has on persons with dysphagia. This research has inspired my interest in the medical fields of speech, such as feeding and swallowing. Currently, as a graduate student, we are applying for externships and I hope to work in a hospital. After graduate school, I would like to use and apply my knowledge and skills in the neonatal intensive care unit.
I have been interested in the medical field of speech-language pathology for a few years now. My interest originally started when I saw my grandfather suffering from aspirational pneumonia in the hospital. At this time, I did not know oral care impacts dysphagia. I saw the impact that the SLPs had on my grandfather, and I realized that this was something I wanted to pursue. This research has shown me that it is important not only for SLPs to have knowledge, awareness, and understanding on oral care, but also that they need to spread this knowledge, awareness, and understanding. This knowledge has inspired me to work with those who have swallowing challenges. The benefits of oral care have recently gained greater attention in the field of speech-language pathology. College programs now focus on teaching important fundamentals of dysphagia, but they may miss opportunities for stressing the importance of oral care. In order to better understand this issue, it is important to know how the level of awareness and knowledge students have at the onset of their studies, as well as the knowledge they gain with increasing experience in their education and training. This research will contribute to the body of knowledge regarding the SLP's understanding of the importance of oral care in the multidisciplinary management of people with dysphagia.
COVID-19 is a difficult topic to talk about right now, but it is important to be aware of how it is affecting patients that are diagnosed with it. The role of the SLP during the COVID-19 crisis is to evaluate patients' ability to swallow safely after prolonged intubation resulting from respiratory failure. The SLP needs to ensure that oral care is performed for these patients who have been extubated because they are at risk of aspiration of their own secretions or liquid to prevent pulmonary complications. For these patients, we want to ensure oral care is performed in order for their swallow functions to return to normal. SLPs must ensure oral care is performed in order for patients to resume their oral intake safely. As researchers, we thought this was an important point because COVID relates to oral care and dysphagia. In this hard time, we send our thoughts and prayers to those affected by COVID, as well as acknowledging all the healthcare workers who put their lives on the line to take care of others. We thank you. I have been interested in the medical fields of speech, such as feeding and swallowing. This research has impacted my knowledge because it has showed me the importance we, as SLPs, need to be aware of oral care. It is vital, especially in patients presenting with swallowing disorders, who are at risk for pulmonary complications such as aspiration of oral bacteria. Currently, as graduate students, we are applying for externships, and I hope to work in a hospital. After I graduate school, I would like to use and apply my knowledge and skills in the neonatal intensive care unit.
This research has shaped my goals because it has continued to motivate me to spread and increase knowledge to others on the importance of oral care as it pertains to the area of dysphagia.